Asthma grabbed our attention in 1997 when the haze triggered great concern for asthma sufferers. Many were advised to stay indoors and many more were reaching for inhalers to help them breathe. Worldwide, about 150 million suffer from this common affliction.
Asthma is actually a chronic condition where there is a persistent irritation of the airways. And this is due to allergic reactions due to common allergens or triggers in the environment. For example, dust mite, moles, or tobacco smoke. And in normal people, these allergens do not cause any significant reaction. But in an asthmatic, there is an exaggerated response such that there is bronchospasm or constriction of the airways, and that manifests in wheezing and cough. And there is also increased phlegm production because of the inflammation, and this is manifested by a productive cough where there's a lot of phlegm.
There was one time where I didn't have my spray to hand and it just got worse and worse and worse. I think I had an infection as well. And I remember I was crawling on the floor and I knocked at somebody's door, stranger's house, and just said, "Can you please call this number?" And they called my mum.
Lee, who is an expatriate teacher, has been suffering from asthma since her teens. This drama school alumnus performs in many stage shows locally, and in between performances she finds time to teach drama to school children. So there's hardly time for this asthmatic to pause and catch her breath.
To be honest, I'm a very energetic person anyway. It's not really had a terrible impact on my life. It's not stopped me from doing stuff. I'm very lucky like that. I really don't have it that badly. Yes, it's in my life and it's there every day, but I've had times in my life where I've gone jogging and I've done lots of exercise and it hasn't stopped me. It's never stopped me, actually.
There's also no stopping 6-year-old Kim, who spends every Saturday morning at the swimming pool. The longer, the better, it seems, for this active child who has been swimming since he was 8 months old. As he takes to the water like a fish, there's little hint that Kim is in fact asthmatic. His doctors encourage his swimming, as they say this helps build up his little lungs and allows him to cope with the asthma.
Exercise is very good for anyone, and especially for an asthmatic, because it improves the lung function and also general health of the person. No doubt, asthma may be exacerbated or triggered by exercise in a small proportion, because there is such a thing as exercise-induced asthma, where a person can be totally normal, but when he does exercise, after a couple of minutes, he starts to get wheezy and breathless. In these patients, we usually advise them that they should continue exercise, but to take precautions like taking their inhalers or their oral medications prior to the exercise itself.
Some foods have been known to trigger asthma episodes, especially in young asthmatics. So parents of children with asthma should be aware of the food triggers and watch their children's diet.
One of the well-known food groups are the citrus fruits, because they do contain some trigger that actually cause bronchospasm, which is airway hyperactivity, and this leads to wheezing and cough. And there are other foods like dairy products, which we find also cause increased production of mucus. And in the asthmatic, if he should have an acute attack, he would produce more phlegm. So these food groups have definite correlation with asthma.
So what I want you to do,
in Singapore, asthma affects 1 in every 5 children. The condition usually develops when the child turns about 3 and is more likely to affect children whose parents have had asthma. The good news, however, is that some children do outgrow their asthma in adulthood.
Yes, it does run in the family. And we do notice that, especially if the father or mother or the grandparents are asthmatic, there is a tendency for the child to have asthma. For childhood asthma, there is a lot of factors that actually determine whether you can outgrow it or not. I think one of the main important factors is that if you have a strong family history or you have other associated problems like food allergies or drug allergies or allergic rhinitis or eczema, the chances of outgrowing it is actually much less than someone who has none of the above factors.
Lee is the only asthmatic in her family, and she has suffered with this condition for some 25 years. When she first moved to Singapore in March this year, her asthma eased up for a while. Then it returned, but not as severely as when she was home in Derbyshire, England.
It was around my very early teens, 12, 13, when I developed asthma. And I had a tight chest, didn't know what it was all about. It wasn't too bad. We went to the doctors and they said, yes, you have asthma. And ever since then I've had it. But in varying degrees. Sometimes it's bad and sometimes it's not there at all. It's bizarre. I go in and out of it. But I do rely on my inhalers. I probably take it once or twice a day. It's very much part of my life, asthma.
2, 3, 4.
Lee still counts herself lucky since she has never been hospitalized for an asthma attack.
I've very rarely got to the stage where I've fought for breath. But yes, it's uncomfortable and you can hear it sometimes as well. And if you don't do something about it, then very often my back will hurt because or just my lower back will hurt because obviously my body's working overtime to try and sort it out. But yes, it's just like a big old restriction.
Kim is lucky as well. His worst brush with asthma only saw him being rushed to his doctor to be nebulized.
An asthmatic person can lead a fairly normal life if the symptoms are controlled. And it is one of the diseases that there are a lot of research currently being done to improve further the treatment and management and eventually to look for a cure for asthma. So they should not be discouraged.
For asthma sufferers, the chance of an attack happening anytime, any place, doesn't allow them to breathe easy. Is there a chance that asthmatics can live with the condition under control? Health Naturally examines 2 different treatments for asthma in just a while. As a young man, Melvin Mock was very athletic, so it was troubling when he was diagnosed later in life as being asthmatic. Like most suffering from the condition, Melvin soon got used to his array of asthma medication. But what changed him was an asthma attack back in 1993.
I was actually having a relaxation with my family and my kids. We were playing card games, and all of a sudden I found that I have having an experience of spasm in my lungs, and I find that I cannot breathe. And then I quickly try to go down to the car park to go to the car, and from there I totally couldn't breathe at all.
His close brush with death left him unsettled and fearful that at any time he could be left gasping for his last breath. That was until he met an Australian expert who taught him the Buteco breathing method.
When I learned the method, I was able to reduce my medication significantly. And then after which I went to my doctor to have my preventive medication managed and reduced. And finally I was out of medication.
Melvin is now teaching others the Buteco breathing method, pioneered by a Russian professor. He found that people with health problems, including asthma, breathe too much or hyperventilate, causing the body to cut off the oxygen it actually needs. So techniques to normalize breathing patterns were developed.
People who are asthmatic, who suffer from asthma symptoms, majority of them, their breathing pattern is not within the medical norm. They breathe 2 to 3 times more than normal. people. In breathing, there is a medical norm, just like we have a norm for blood pressure. So it is something which is mostly overlooked by majority of the people. So in the Budeco method, we do breathing exercise to raise back this carbon dioxide level to normal so that people do not experience symptoms of asthma.
The Budeco method, which can be taught to children as young as the age of 4, also encourages a change in habits. So when Melvin met 6-year-old Kim, the first lesson was on the need to breathe through the nose where air is naturally filtered.
When you stay in the lungs,
breathing through the nose also makes it a lot harder to overbreathe, which Budeco practitioners say causes irritation and constriction of the airways.
So after the girl changed to breathing through like a mouse, what happened to the tiger?
The tiger thought, oh well, she was home.
Once upon a time.
The other simple lesson encourages the habit of quiet, shallow breathing. This trains the brain to get used to a higher level of carbon dioxide in the body, which increases the amount of oxygen released by cells. The overall result? Fewer asthma attacks, since the likelihood of muscle spasms is decreased. As for the exercises, they seem simple and even fun.
Basically, the concept is still the same. To raise back CO2 in our body, but during the jumping, because of increased metabolism, the body produces faster and more CO2 level. But for kids, we only use these jumping activities because it's hard to ask a kid to keep on holding his breath.
The exercise is followed by a period of shallow breathing. This is another simple exercise Kim has learned and which he needs to follow daily to keep his asthma in check. It's the same exercise which the adults practice. And yes, it is what you think you see, a case of simply holding your breath. This is known as the controlled pause.
Controlled pause basically is to hold your breath for a short period of time. Depends on the capacity of the person. It can be 5 seconds, 10 seconds. Now, the objective of this controlled pause is to raise back CO2 in our alveolar air in our lungs to normal level.
The aim is to work up the control pause for up to a healthy 40 to 60 seconds. The aim of this is again to increase carbon dioxide levels in the body. After trying out the exercises for about a week, asthma sufferer Lee has found some good results.
But at the moment, I'm rehearsing for a kids' show. It's very physical and I've never done anything like that before. I could quite easily take my spray, but I've managed to keep off it, which is amazing, really.
The Budeco method has been the subject of a number of medical studies, and in Australia and Britain there are some in health circles who are giving more consideration to this technique, debunked a decade ago as a dangerous technique.
Usually people come in, they can be on reliever medication as well as preventive medication. When they go through a few sessions of Budeco method, they find that their symptoms of asthma ease, or even there's no symptoms.
And that's where the problem started, when asthmatics practicing the Budeco method started to put away all their medication.
Okay. Reliever medication is only used when it's needed. So there's no symptoms of asthma, they don't use any more reliever medication. Now for their preventive medication, they are strongly instructed to go back to the medical doctor to be supervised and by the medical doctor on the reduction of the preventive medication. Because sometimes people may feel that they do not have symptoms, they may lack the understanding. So in the Budeco method, we also caution them that preventive medication have to be continued. They cannot reduce it by themselves. It has to be always supervised by a medical doctor. And after the Budeco workshop, they are also reminded that they must always carry their reliever medication, just in case for emergency.
Another misconception about the Budeco method is that it is a cure for asthma.
Asthma is a condition. It is a reversible condition. Asthma is common symptoms of the hyperventilation syndrome. So we cannot associate the word cure, because in the first place, it is not a disease.
The Buteyko breathing method may seem like child's play with simple-to-do exercises. And if you think you can now try it out yourself at home, it's best, like in all matters concerning your precious health, that you first check with an expert.